ischemic strokes. Now we're going to move to the 1 out of every 5 strokes that are not ischemic strokes, and that's hemorrhagic strokes. Hemorrhagic strokes are a result of bleeding in the brain. Number 1 risk factor for a hemorrhagic stroke is untreated high blood pressure. However, in rare cases, some people are born with brain aneurysms and things called arterial vascular malformations, which will sometimes rupture and cause a hemorrhagic stroke. Here's a video about it. Now here's something we hope you'll really like.
Your heart pumps blood to your brain through blood vessels in your neck. These blood vessels, called arteries, branch into even smaller arteries that bring blood to your brain cells. Some of these small arteries join each other to form a loop known as the Circle of Willis. The walls of the arteries contain special muscle and elastic layers that help them adapt to the blood pulsing through them. Sometimes diseases, injuries, or birth defects can cause a weak spot in the wall of the arteries in the Circle of Willis. These weak spots usually form where arteries branch. Over time, the pressure of blood flowing through the artery stresses the weak spot further. The constant blood pressure can cause the weak spot to balloon out and form a bulge called a cerebral aneurysm. This cerebral aneurysm is the most common type, called a saccular or berry aneurysm. Over time, the aneurysm may grow and push on nearby brain tissue or nerves. Blood may also leak from the aneurysm. If its wall gets too thin, the aneurysm can burst or rupture and spill high-pressure blood into the space around your brain. The blood presses on your brain tissue and can cause injury to your brain cells. Chemicals in the escaped blood can irritate other brain arteries and cause them to narrow. As a result, your brain can swell, leading to serious brain injury. Common symptoms of a ruptured cerebral aneurysm include sudden severe headache, sometimes called a thunderclap headache, problems with your vision, such as blurred or double vision, nausea and vomiting, a stiff or painful neck, or confusion. An unruptured cerebral aneurysm may not cause symptoms, but large unruptured aneurysms may cause headache and pain near or behind one eye, double or blurred vision, a drooping eyelid, and numbness or weakness on one side of your face. A ruptured cerebral aneurysm is a medical emergency. If you are having symptoms, seek immediate medical attention. If you have a ruptured cerebral aneurysm, your doctor may recommend surgical clipping or endovascular coiling. In surgical clipping, your surgeon will make an opening in your skull near your aneurysm and place a small metal clip onto the stem that connects the aneurysm to your artery. The clip blocks blood flow into your aneurysm. In endovascular coiling, your doctor will put a plastic tube called a catheter into a large artery in your groin. Using a live X-ray view, your doctor will advance the catheter through your arteries until it reaches the aneurysm. Through the catheter, your doctor will insert one or more flexible wires into your aneurysm. The wires will coil up and cause a blood clot to form inside your aneurysm, which will block off the aneurysm from the rest of your artery. In a similar manner, if you have an unruptured cerebral aneurysm, your doctor may recommend surgical clipping or endovascular coiling. In addition, if your aneurysm is small and not causing pain or other symptoms, your doctor may observe your aneurysm for a period of time before performing either of these procedures.
All right, boys and girls. Any questions about hemorrhagic strokes? Signs and symptoms: they'll have a severe headache like a thunderclap that comes on suddenly. They'll lose conscious rapidly. When they vomit, it will literally, they're on their back, it will hit the roof of the ambulance. They also blood chunks straight into the wall.
Yeah, I saw that.
Saw it today? I thought you had a STEMI today.
Well, it was, but I mean, he puked all over the place, like projectile puke the whole head.
Wow. Exorcist stuff?
Huh?
Exorcist stuff?
And it was 2 minutes straight of just absolute projectiles.
You gonna stop and get a priest?
Huh?
Did you stop and get a priest?
We almost stopped at the church and
Yeah.
What would cause them to vomit so?
Pressure on the medulla oblongata. That's why alligators don't have projectile vomit.
I've never seen so much puke in my life. Never.
So as the brain gets squished, it blows a pupil. Fully dilated, you can barely see the iris. It's like a big black spot in the center of the eye.
Oh,
I had one today with 2 blown pupils.
Today?
Yeah,
wow.
very bad. No. Massive head trauma. But no intracranial pressure because the skull was so massive open skull fracture, so all the blood was running out. So no pressure.
Well, that's good.
Vehicle versus pedestrian, they think.
With this endovascular coiling, we just leave the coils in there.
No. Well, I don't. That's a good question. I actually don't know. I don't believe so.
It would seem like
I
tissue
would say
kind of dissolve around it.
No, because well, the clotting, it clots are on the coil. That's what's put the coil under. For the clots to bind us, they have to leave it in there.
But so,
Because they tear it out and rip the clots out, and start to bleed again.
yeah,
I don't know. I don't know enough about coil binding, and I don't think they use it that much anymore. Usually, that's way behind the 8 ball, unless they catch it real early. Any questions? Cushing's triad. It's another one.
for.
High blood for hemorrhagic stroke, high blood pressure, low pulse, deep irregular respirations.
So I've also heard of Cushing's triad is, the difference between diastolic and systolic, not,
It's wide,
okay,
wide pulse pressure.
why, so. Is it either or is it? I'm hearing both, I've been hearing it's high blood pressure or.
In the cases that I see the Cushing's triad, it's at like 230 over 100. That's still a pretty wide pulse pressure. It's 130.
Well, like what Tom was saying is it was widening, so if you took the first set of vitals at like, whatever, 120 over 80, and then it was.
Yeah, I don't think you're gonna see that. Let's look. Does the pulse pressure widen in Cushing's triad? What happens to the pulse pressure? Widening pulse pressure. No, it's just a widening pulse. The blood pressure is still going up, but the pulse pressure widening. Both the systolic and the diastolic are going up, but the systolic is going to go up faster. Does that make sense?
The gap between the two becomes larger.
Yep. What do we do? Keep the airway open, high flow tube, be ready to ventilate, keep the gurney up 30 degrees and get them to the closest stroke center as quickly as possible. These have a very, very low survivability. Brings us back with transischemic attack. Any questions on hemorrhagic stroke? Signs and symptoms, treatment? All right. Transischemic attack symptoms usually resolved on their own within 24 hours, usually within 15 minutes to 45 minutes. Are we okay back there?
Yeah, I think so.
Transischemic attack. Similar to angioma's brain cells, yes.
What does the transient mean in this context?
It's usually people that are unhoused.
In this context.
Urban outdoor.
I'd say because it's not consistent and it's whatever the term transient is for. In other words, it's not consistent.
It's like,
1 second. Transient, medical terminology.
transient's kind of first one.
Short-lived, passing, and not permanent.
Oh.
They call it transient. Anyway, angina would be a transient. So one of the ones they don't talk about, but is common, not common, but is out there is the hypoxic stroke. So the ischemic stroke is a hypoxic stroke, but when they talk about hypoxic strokes, the reason why it's different than ischemic strokes is because it's not from a clot, an embolus, or an emboli. It's from not breathing. Like someone that's been not resuscitated, they laid too long without breathing, and the brain strokes, dies because there was no ventilation. Drowning victim or a cardiac arrest that no one started CPR on for 10 minutes. A lot of, so we used to have a vet, geez, I almost said that out loud. We used to have a subacute facility in Mass Shasta.
Yeah.
Yeah, I did not almost call it a vet farm. Which had literally 40 beds of people on ventilators permanently. And there were 90% of them were from hypoxic strokes. Majority of them were skateboarders and hypoxic strokes and TBIs. Most of them were gangbangers and skateboarders without helmets. No, it came from everywhere. The subacute means that you're too well to be in an acute facility, but you're way too sick to be the skilled nursing. To be able to flow to, so basically full-time ventilator patients, brain dead patients. Full on hypoxic stroke, there's no brain left, just the vegetative functions. Any questions? Yeah, exactly. Like we said, Terry Scheibe was breathing on her own though. She was just trained to. She wasn't on a vent. She was actually better than most subacute patients. She was a SNF patient, skilled nursing facility. That's what they, how'd that end? Husband one? Get the insurance? Probably. Terry Scheibe. It's like a big nationwide court case about a massive hypoxic stroke of a lady, and the husband wanted to stop the feeding tube, and the parents did not want, and went to a full on legal battle, big time legal battle.
What's Brian? What's an anoxic brain injury?
Anoxic brain injury is a hypoxic stroke. It's from lack of oxygen.
Well played, well played.
Wow. Somebody's really funny. That's okay. Warren left his email open somewhere today because I got a really nasty email from him. So I showed it to him. I go, thanks, Warren. He goes, I didn't write that because my email's open somewhere. Pretty funny stuff.
What did it say?
I can't repeat it in class. There's profanities in it. There's a profanity 4-letter word that starts the letter F. And then, yes, fire truck. And then a French term for sheep. And then the word Brian, that's all it said.
Hey Siri,
What's
the French word for sheep?
you. E-W-U.
It's not French, is it?
Not Italian.
Ask, what's the French saying for a seal? Ask
All I know is when they see like at the comedy stores, the blow up sheets, they call it love you tender.
Speak seal in French.
Right. So there will be a lot of test questions on stroke mimics. These are things that act like a stroke and make you think that it's a stroke, but they're not actually a stroke. Kind of like the Antifa medics and riots. So a transischemic attack will mimic a stroke until the brain gets oxygen again. Can't teach that in the yardstick. Hypoglycemia, low blood sugar will definitely shut the brain down and act like a stroke. Then a post-ictal state. So a post-ictal state is very different than a postal state. First on the job shooting. So it's nothing to do with each other. So what is a post-ictal state? So post-ictal state is when your brain has a seizure, which is ventricular fibrillation of the brain, basically. Your brain has a seizure, which is complete electrical chaos in your brain. Then it finally ends the seizure, it completely shuts down, and then your brain has to reboot. Well, unlike your heart, where the P wave just takes over, the SAE and starts going beep, 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 beep. Your brain can take anywhere from 10 to 20 minutes to hours to completely reboot. So that period of time while your brain's rebooting after a seizure is called a post-ictal state. And sometimes only one half of the body will wake up before the other half is. That's why it mimics a stroke.
So they're like extremely lethargic, confused.
A lot of times they can't talk, completely paralyzed on one side of their body. They often are in a primal state because they're coming out of the post-ictal state, which is true. Fight or flight. Any questions? So how are seizures caused? By things like this.
In sich.
I was taking a bath home about a Saturday night.
That's how you cause a seizure. Hold on a sec. But there's no live TV of it. There's a massive riot and looting going on in Philadelphia right now. No,
Right.
no live stream. Kensington Station looks the same as always. Like riot looting, that's what we do every day here. I have no idea.
That police officer was acquitted, the one that was supposedly charged with murder of somebody. And he was acquitted by the judge, so he said he's.
Probably because there's facts and evidence instead of fake news.
Look, man, you're preaching to the choir.
That's usually the case. People that are guilty usually get found guilty, like the guys that chased those kids down and murdered them.
Dude, that's crazy stuff, right?
Or like the paramedic and the EMT that murdered that guy.
Yeah.
All right, so grand mal seizures, that's a full-bodied, tonic-clonic, rhythmic, violent shaking. Someone tells you they had a seizure, they can tell you the length of it, they didn't have a seizure, because you're not cognitive if you're having a seizure. It's physically impossible to know. Yeah, some people that have been epileptics for a long time, they'll know they had a seizure because they bit their tongue and they wet their pants when they did it. So that's how they know they had a seizure. But I'll tell you, oh, I was shaking for like 2 minutes and then it went away and then, no. Seizure is also the most common complaint that is falsely reported. It's the best way to get sheltered. I mean, second followed red in the chest pain. Next. Then we have petite mal seizures. That's what people just blank out. No violent rhythmic activity. They're just not there. We call that a petite.
Is that like McConnell?
Yeah.
Has that look, it's so weird too.
I thought he was a Disney princess when he was doing that Frozen. I was just that song "Let It Go" in my mind when I see him, you know. Let it go. Talking about Mitch McConnell,
Oh, yeah.
poster child for terminal.
Turtleneck itself.
Well, they already, the last one, we already had to trim it. I got told by YouTube, I had to cut out the Aussie CPR video. This copyright protected. Now I get in trouble for that. A very bad Aussie accent. It was good. Doing a good job, lads. All right. Here's a better explanation of a seizure than I'm giving you. Some nice calming music so you don't know what a seizure is.
Normal brain activity shows neurons firing as different regions of the brain become activated. Notice how the different neurons alternate their firing patterns as they communicate their messages throughout the brain. During a seizure, large groups of neurons fire simultaneously, demonstrating hyperexcitability. This activity can be likened to an electrical storm.
Kind of like ventricular fibrillation, but in the brain. Is it like really hot here?
Yeah.
I'm like dying. You can open the door. I don't think the window's open. Oh, they open up top, yeah. I think the door would be better. Just don't let any bats in.
Okay. Watch out for that.
It's happened. We've had bats get in here before. Yeah, no, I left.
Simple partial seizures. Person remains aware, cannot completely control function or behavior, commonly referred to as auras. These seizures or auras are characterized by strange or unusual sensations, a whirling or tenderness in the stomach area, odors, or visual abnormalities. Other characteristics of SPS include sudden or restless movement, hearing distortion, and a sudden sense of fear.
Alteration of consciousness or memory is generally not associated with simple partial seizures. Complex partial seizures. Person experiences impaired consciousness, cannot completely control function or behavior. Complex partial seizures are often preceded by an aura. Auras are not unconscious acts. They are the funny smells, tastes, déjà vu, fear, and many other conscious warnings patients may experience. They are often identified by the manifestation of complicated motor and sensory action. There may be some change in consciousness or memory. A partial seizure seen here in the temporal lobe may spread, becoming a generalized seizure. A generalized seizure affects the neurons of the entire brain. A generalized convulsion occurring in two phases. Tonic phase, stiffening of the muscles, the person loses consciousness and falls as the body grows rigid. Clonic phase, body extremities jerk and twitch. After the seizure, consciousness returns slowly. When the person wakes up, they are often confused or disoriented. Characterized by a complete loss of awareness. The person may stare into space and appear to be daydreaming or in a daze. Absence seizures are not preceded by a warning, aura, and are followed by normal activity by the individual. There is very minimal movement during the actual seizure, so many times it may go unnoticed by others. Some types of seizures, especially if prolonged or repeated frequently, can damage the brain.
Bring my projector since it's sitting outside. It's kind of nice evening on, you know. Got the football field, do a drive-in movie. Yeah,
So what is the kind of seizure that people just have seizures all the time when watching a fight?
generally tonic-clonic, the ones you're gonna see.
We had a girl in our sports break class that just went back, she just passed out, hit her head on the whiteboard and said a seizure.
So sometimes a lot of those seizures are what they call pseudo seizures, where it's not, they don't do it on purpose, but they're not actual real seizures. They're more of a psychological response to stress. So,
She is pretty seizure.
yeah, if they're immediately awake afterwards, it was not a seizure. And if they didn't wet their pants or bite their tongue, it usually isn't a seizure. Something else. Because if you have a true seizure, you lose control of all your bodily functions, including holding your bladder. So unless you're completely dehydrated, your pants will be wet. Questions? All right. So they don't really know what causes seizures. Epilepsy just means seizures of unknown etiology. That's what epilepsy means. They have seizures. High fevers in small children are febrile seizures. That is different than epilepsy and tonic-clonic seizures. It's a seizure that breaks the fever. There's no link to them becoming epileptics later in life. Now, TBIs, traumatic brain injuries, those can change the structural components of the brain or brain surgery, and that can leave people as epileptic. Same thing with metabolic disorders. Hypoglycemia can cause seizures. Same thing with overdoses and poisons. Yes. Right, that's a structural change because the brain tumor is squishing and changing the where the electrical pathways are. Any questions?
Higher.
Yeah, high children, they like 104, 105. But after the seizure, the people go, oh, their seizure, their fever's not that bad because the seizure actually breaks the fever. I don't know the etiology of how it does it, why. I don't know. Shivers generate heat though. They don't. You shiver because you're cold. So, if it's a true tonic-clonic seizure, they'll lose consciousness, full body, violent, rhythmic. Generally will bite their tongue or lip. They'll lose control of their bladder, sometimes poop. It can last there 30 seconds to 5 minutes. It's terrifying to watch. They'll have that post-ictal state, 5 to 20 minutes, sometimes up to an hour or two. Any questions? Yeah.
So we had one that was, it took us 10 minutes to get there. She was seeing the whole time I was there, 10 minutes. But she was still seeing the ambulance. How rare is that?
Pretty rare. That's status epilepticus.
And that having to do with drug use?
Good, absolutely. Absolutely. So here's the big thing about post-ictal states. They're not able to manage their own airway. So if they stop seizing and their airway is closed, they die. Kids, it's common. Kids have seizures that are unwitnessed and they're big bobble Charlie Brown hits. Closes their airway, they're dead. When I was a kid, they used to call it swallowing the tongue. Oh, little Johnny swallowed his tongue after a seizure and died. It was so sad. I used to take my time. How told you to swallow your tongue? Couldn't figure it out for years until I took EMT and said, oh, so I shut the airway off. They have little tiny weak anterior airways, this big giant head and a big giant tongue. And it closed their airway and they were post-ictal and they couldn't wake up and adjust their airway. That's why the first thing you do is adjust their airway. When they get to that post-ictal state after
How does
surgery.
their airway go?
It's where the head's positioned.
Okay.
It's in adults, it's not as common. Kids, it's common. But adults, it can happen too. You know, it's one of those with adults, it's hard to say though, because sometimes adults go into seizures because they go into ventricular fibrillation, and when the brain gets hypoxic, they seize. And sometimes they seize and then shut their airway off and go into ventricular fibrillation. So it's kind of one of those, which came first. Any questions about status epilepticus? Treatment of seizures. Wow. Try to move the patient, don't move the patient, move everything else away from the patient and let them seize till they're done, then immediately open their airway. Have O2 ready, prepare to ventilate. Any questions? All right, one of the most common medical emergencies you'll be dispatched to is altered mental status because it's a catch-all for many, many, many disorders. We're gonna go over what they are. AEIOU tips. That's what you should be thinking anytime you have someone with an altered level of consciousness. Yes.
What is acidosis?
Acidosis is when there's a buildup of lactic acid in your blood, usually from not breathing or not having your metabolism working. So low perfusion, low circulation, or hypoventilation. Did you just walk in? Lewis is a miracle worker. this chair before. Now you're walking. He's a miracle worker. Good thing he's not here. Any questions on AEIOU tips? Just think of the song, Bingo, the farmer. So it'd be BINGO, it's AEIOU. Well, actually, no, wait a minute. Think of Vanna White. Wheel of Fortune. Here's a good critical thinking question for you guys. It won't be on the test, but it works on your critical thinking skills. In the children's song, Bingo, about a farmer and his dog. Who's named Bingo? Is it the farmer or the dog? How do you know? There was a farmer who had a dog and Bingo was his name. How do you know they're not saying the farmer's name was Bingo and he just happened to have a dog?
Never been a single farmer named Bingo.
You met a dog named Bingo? I've never met a dog named Bingo.
It's a pretty good dog.
Ever met a person named Bingo?
Yeah.
Yeah, as a matter of fact, I go, a lot of the churches around here play with them all the time. And say, come play bingo tonight. There's no dogs there. Just some old guy with a cage with a bunch of balls in it. A lot of old ladies with crayons. Any questions about bingo? I mean, AEIOU tips. All right, hypoglycemia, low blood sugar. It can mimic a stroke, it can make you alter. It can cause seizures. The cure is sugar, yeah. Glucose. Any questions? Do you give oral glucose to someone that's very altered? No. Got to be able to be alert and confused. Their eyes are closed, you don't give them oral glucose. You call the paramedics and let them give D50 or D10 now. Any questions? Any questions? I can't get bingo out of my head. Just keeps going. P-I-N-G. The people that wrote that song went on later to do infomercials. But wait, call this number, you know, because keep saying it again and again and again. B-I-N-G-O, B-I-N-G-O. It's my theory at least. Yes.
Why would you consider hypoglycemia after a vehicle crash or injury?
Because sometimes people take insulin, which takes all their sugar out, so they rapidly drop their blood sugar. Then they try to drive, then they crash into things. It's actually a reasonably common. Anyone that has altered mental status or altered neurologic function, you should check a blood sugar. You should not check a blood sugar on every patient. Some nurses and hospitals tell you that. You check a blood sugar on every patient, it's a vital sign. One, it's not a vital sign. Two, if they have no altered neurologic function, all you're looking for is a number. You don't treat numbers. You treat positive findings off your assessment. Any questions?
Would you still consider it if it was obvious head trauma?
No. No. Yeah, no, I wouldn't do that because it's obvious syndrome. Again, do your assessment. It's just one piece of assessment tool. Yeah. If they got gray matter oozing out their ears, it's probably not hypoglycemia. Right, pale, cold, and wet. Tachycardic. Well, then maybe. What do we do for these people? Make sure their airways clear and open. Get ready to ventilate. O2. Any questions? Ooh, let's see what you guys have learned. You're dispatched to a single family home for a man with altered level of consciousness. What do we do first? Scene safety. Your PSI is on. Your patient's grandson meets you at the door. He states his grandpa had a sudden headache and then vomited. There's only one patient. You have your partner and a crew of 4 staffed engineers. You don't need help. C-spine does not appear to be indicated. What comes next? What? Primary assessment. The gentleman patient is an early 60s male sitting in a bathtub. He's covered in vomit. He appears to be very ill. His eyes are closed, but they open to pain. Your complaint is he's obviously altered. Patient has vomit on his lips, but his airway is clear. He's breathing adequately at 28 and it's deep. He's got a strong bounding radial pulse. This is a priority patient. What's next? History taking. Onset was 15 minutes prior to arrival. Provoked, he was looking for his car keys to take his grandson home. That's kind of scary. Quality of radiation are not applicable. Signs symptoms complained of a severe headache prior to the decreased level of consciousness. Time he has not been speaking for about 3 minutes prior to your arrival. It's got aphasia. That's not good. What's next? All right. Oh wait, we still got our sample. So it's altered vomiting and bounding pulse. He's allergic to penicillin. He takes Inderol, hydrochlorothiazide, and potassium. Those are all hypertensive drugs. Grandson says he's got a history of hypertension. They're going back to the grandson's house to wait for his parents with sudden onset severe headache, vomited straight to the wall, and rolled without up to the damn uncle. Now the secondary. Blood pressure is 240 over 130. Pulse rate 60. Respirations are 28. His eyes open to pain. He's verbally mumbling, blah, 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 blah. And he withdraws from pain. What's his classic coma scale? 8. Oh, sorry. It's what?
8.
How'd you get that? Your instructor blurted it out.
2 for pain, for cramps.
Or for what? 224. That's correct. Is it really? So he's incontinent urine and stool. His next set of vital signs are even worse. So what are your positive findings? This is the way you guys do this. Okay, you've done your assessment. Now let's look at your positive findings. Thunderclap headache, projectile vomiting, hypertensive, rapid loss of consciousness or rapid decrease in level of consciousness, incontinent in the urine, Cushing's triad. What do those positive findings give you a general impression? Hemorrhagic stroke. That's how you do a patient assessment. Look at your positive findings, form a primary impression, treat the patient. Questions? All right, let's do another one. Look at your positive findings, form a primary impression, protocol based off your profession. You're dispatched to a man down at the local city park. What comes first? So everybody's got their BSI on. Patient was found by the police in the park. I'm confused. Everybody's got their you have your crew and entry company. Patient's confused with unknown etiology, so you do take spinal precautions because you have no idea if Bigfoot hit him with a baseball bat and ran back into the woods. Any questions? You never know. All right. What's next? Your primary impression. Yeah, I know I screwed up. Give me 1 second. Let me check Portland, Navy. Nope. All right. Prior assessment appears to be a mid-30s hygiene challenged male in the park. Imagine that. Eyes are open, but he's not speaking. He's got an ultra level of consciousness. Airway is clear. He's breathing adequately. He's got a weak, rapid radial pulse. Determine that he's altered mental status of unknown etiology. So yeah, it's a priority patient. What's next? History. Nobody knows him if he's not talking. What's next? Got a blood pressure I could kill for. Pulse rate's 124. Eyes are open. He's got no verbal. He's not following commands, but he's moving purposely. What's his GCS? Not even close. No. You guys can do better than this. How many points for eyes?
4.
How many points for verbal? What's 4 plus 1? How many points for motor? Nope. 5. 5 plus 5 is? Very good. GCS 10, he's bleeding from a wound on his tongue. Neck and chest are negative, lungs are clear and equal, abdomen soft on tender. He's incontinent of urine, which means he weed his pants. X-rays are negative, his back's negative. So we've got an altered GCS of 10, bleeding from the mouth that nobody knows anything about, nobody saw anything. He's also incontinent of urine. Let's take a look at the second set of vital signs, see if things are changing. Numbers are about the same. Let's look at his glass count. His eyes were open, but now he's verbal, can talk, but he's confused. And he's still moving all extremities, but not following commands. Now what's his GCS? How many for eyes? How many for verbal? 4 plus 4? How much for motor? It says motor patient is moving his extremities. That's purpose. No. How many? There is 8 plus 5 is. So this is GCS improving. So he's all GCS improving. What does that give you a primary impression of? Post-ictal state. Good job. You guys are learning. All right. We'll go through this, but we're late. We're already supposed to be on abdominal emergencies. Thoughts for the day. When you become an emergency service provider, you will become an icon and an example. You are being watched constantly. You are being videoed. You're being photographed. Your actions are taken with respect to many times out of context. And they will post things about you on social media that are completely untrue and absolutely ridiculous. They have no idea what they're talking about. It is the utmost importance that you be the best that you can be, no matter what other people are videoing, taking pictures, talking about, or posting about you on the internet. Doesn't matter. You have to be the best that you can possibly be. That's all that matters. You don't want to be the face for the person who is not at their absolute best and trying to be their absolute best at time if you or a family member are in a life-threatening emergency. Don't be that person. Any questions? All right, so we're going to list all the abdominal organs again. Third time we've reviewed this. We're going to go over the hallowed organs. We're going to go over the solid organs. We're going to go over the medical problems associated with it, the signs and symptoms of the medical problems, how to treat them. You have 4 quadrants. Any questions on your 4 quadrants? So your solid organs, your spleen takes up the majority of your right upper quadrant, not your spleen, your liver. This is kind of talking. Your spleen and your pancreas are in your left upper quadrant, and your ovaries are in your right and your lower left quadrants. And then behind your abdominal sac is your kidneys in the retroperitoneal switch. If you don't have ovaries, what do you have there?
All right, just check.
That's where they had the extra. What do you think should be there?
Stomach stuff? Small.
Large intestine, why it fills that spot. All right, no one's ever asked that question. I don't know. Hallowed organs, this is where I always go. With switch chasing me, trying to see eviscerated hallowed organs. Gallbladder, your right upper quadrant, your large intestine. Stomach, your left upper quadrant, large intestine, small intestine. Lower quadrants have your bladder, large intestine, small intestine. Those are your hallowed organs. The older you get, between like 9 p.m. and 12 p.m., get your sleep hours. Any questions? So the peritoneum holds all of your guts except for kidneys in place. And if you get a ruptured appendix, that'll cause peritonitis, which is an infection or an inflammation of your peritoneum. Digestion takes place in all 4 quadrants using all of your hollow and solid organs, except for your ovaries. And the urinary system begins in the kidneys in the retroperitoneal space and ends at the genitals in the anterior part of your pelvis. Any questions about digestion in the urinary system? I might take this way too.
Jack Link's Beef Jerky presents Messenger
This actually works.
Sasquatch. Jack Link's Jerky, feed your wild side.
How it works. Any questions? I thought it would be helpful if you passed the test. So remember, referred pain, the somatic system, nervous system refers the pain to areas of the body other than where the actual inflammation or
food actually is. Any questions?
Time for you guys to sit down. No questions? Here's a list of all of the gastrointestinal problems you can have. And we're gonna go over each one. First of all, let's go over what can cause gastrointestinal problems. That's where it all starts, folks. Ulcers. It's when the lining of your stomach gets eroded away and the acid eats the wall of your stomach or your GI tract. They used to think it was from stress. It truly is, but it's actually from a bacterial infection that when stress, you get stressed, your immune system lowers. So when it takes over, eats far enough into the wall of your stomach lining, it can cause bleeding. Usually heals without any intervention. Any questions? Signs and symptoms of burning, gnawing pain, usually if the stomach is empty or full. It's usually relieved by eating small amounts of food, generally carbonated drinks. Also associated with nausea, vomiting, hot burn. Questions? Questions? Ah, that's a good question. So the sphincter that opens the stomach up to the large intestine or the small intestine is relaxed by carbonation. It's able to enter the small bowel, which then relieves the pressure inside the stomach. Then you don't have the more acid being released to try to digest more food. It's also why carbonated drinks make you fat, because you can take in more food because it relaxes and moves through your system. Gallstones, also known as, and you need to know this term, cholecystitis. Cholecystitis is a disease of the gallbladder. It is a common disease in America, a very common disease. The gallbladder releases digestive juices and digestive enzymes from your liver, and helps break down the food to aid digestion. Works very well until your gallbladder gets diseased with cholecystitis. And then it turns those digestive fluids into more of a sludge, which then turn into rocks. And then the rocks block the bile duct going from your liver to your stomach, from the gallbladder to your stomach. And then you get hydraulic pressure behind it. Those sharp edged rocks are tearing through the lining of your bile duct. Outrageously painful. Makes you really sick. Now, we talked about this a little bit in the past about genetics and stuff. The 4Fs are the most common type of people that are at risk of cholecystitis. Being female, fair skin, i.e. Caucasian. High fat diet, they like pizza. And over the age of 40. Those 4Fs put together are the largest percentage of cholecystitis patients. So what happens, they'll have a high fat meal, and about an hour after the meal, they'll start feeling intense burning chest pain or a right upper quadrant pain. Any questions? However, if you don't have the 4Fs, you can still get a lot of males get cholecystitis. That's what it looks like. That's a very diseased gallbladder pulled out there with a lot of stones. So imagine those stones getting pushed with hydraulic force down your bile duct and the amount of pain that would cause.
Are they like rock hard?
Rock hard and rigid edges. Good. So if you ever get cholecystitis, tell the doc you want the freaking stones for slingshot. Any questions on the signs and symptoms of cholecystitis? All righty then. Pancreatitis. Your pancreas is an incredibly important organ because it releases a hormone called insulin, which is a requirement to survive. If you don't have insulin, it's impossible to survive. Glucose, yes.
That can be caused by like birth defects, right?
Pancreatitis? It's possible, but I haven't heard that before.
My dad had it for a while, and it was because something like a birth defect made one of his, I don't know what it was, but it like.
Might have caused a shunting, like the artery going to the pancreas that feeds it.
Yeah, it was something like one of his ducts was like his, I don't know the word proper vocabulary for it, but one of his, like, the big duct was smaller than the small duct. So it was like.
The pressure changes wouldn't work.
Something like that.
So the majority of pancreatitis is either caused by cholecystitis or by massive alcohol use. And the complications of it is you can't eat, so you're going to lose weight. Other complications of pancreatitis is sepsis and hemorrhage. Any questions? Signs and symptoms of pancreatitis could be either right or upper left upper quadrant. Usually a severe pain that radiates the back, associated with nausea, vomiting, fever, tachycardia. Questions? No. Any questions about pancreatitis signs and symptoms? So GI bleeds. You have GI bleeds that are upper GI bleeds, you have lower GI bleeds. So upper GI bleeds are generally associated with the stomach and the esophagus. Lower GI bleeds are generally associated with the large and small intestine. Both can be life-threatening if they go untreated. Almost every GI bleed is a result of another disease process, such like an ulcer or we'll get to liver failure that goes into your esophagus, portal hypertension, esophageal varices. Took me a minute. Any type of GI bleeding should be considered serious event. So, if people vomit, coffee ground type emesis. Emesis is the vomit. And it looks like coffee grounds from a coffee filter. That is generally digested blood. That's the signs and symptoms of upper GI bleed. It'll smell pretty often. If they're vomiting bright red blood, that's what they call an active GI bleed. It's pretty rare. Now, lower GI bleeds will usually present with a very foul smelling stool they call melena. That's like tar. That's from digestive blood through the intestines. Also. And then esophageal varices is when people are in liver failure, which causes hypertension to the portal vein, which then puts pressures on the wall of the esophagus. Remember, your esophagus is a soft tissue muscle. It's very vascular. When it puts pressure on it, what it does is it actually puts out these little aneurysms, and then they start to bleed. They'll actually rupture. And I have fantastic videos that YouTube took away of the doctor. Here does their doctor going in and banding them. He has to go in and lasso them and band them and cut it off to stop them from actively bleeding. Pretty cool to watch. But esophageal varices is deadly. Those people, that's the next end step of liver failure. So, any questions? However, I did have a buddy I grew up with who, at 43, they had to band his esophagus for varices. The doctor told him, if you don't quit drinking, you won't see 45. And he made it to 51. Showed that doctor didn't know his talk about never slowed down. 51 though, finally got it. Any questions? All right. There's your signs and symptoms, upper versus lower. No, they're not. One has coffee ground emesis from their vomit, the other one has black tarry stools. One has weakness, the other has nausea. You guys are too smart.
So hematemesis is the same as the top ground emesis.
No, hematemesis is generally usually when you're coughing up blood.
Okay.
That's usually from your lungs and your respiratory tract.
For sure.
Yeah.
I thought it was hemoptysis.
Well, it's however you want to pronounce it.
Hemoptysis.
Are they different?
The book says hematemesis is frequently seen in patients with upper GI bleeding.
Maybe it's vomiting then. The hemoptysis must be the coughing. There you go. I'll be honest with you, I've never noticed the difference. been a day or two since I took my EMT test. I apologize.
The
I can do better than this as an instructor.
hematemesis would be like an active bleed.
Yeah. Because if it's red blood, it's active. If it's coffee grounds, then it's been digested. So the other thing about varices, when you smell varices, you will never forget it. And I know varices now before I get out of the ambulance. As soon as I open the door, somebody said the house has varices, I can smell it from outside.
Not bad.
It's that bad. It is the worst smell you'll ever smell in your life. It's like a combination of the worst smelling diarrhea you can imagine and vomit at the same time. Yeah. And they're usually profusely vomiting it out of their mouth. It's ugly stuff. Oh, look at that. Any questions? Usually the partially digested blood. Mixture of blood and digestive enzymes and acid. Absolutely. See, this smells nasty, but it's not even the same league as varices. Varices is bad, and it's distinct. I'm trying to think how else to decomposition.
I mean, that's like the worst thing.
It's not. You know, it's kind of like a dog show. You got to evaluate each on their own merits. I'm not sure what those are both real bad. I can't say it's worse than decomposition.
If you can smell that, I'm sure. when you get it.
From the street.
Yeah.
Oh man, yeah, I shouldn't tell this. Now, a couple years ago, I was out jeeping, and we were going past Twin Arrows. Campground. And Twin Arrows occasionally does smell like sewage, and we're driving in. We got the roof off the Jeep, and my wife goes, "Oh my God, that's awful." And I go, "Yeah," I said, "I can't tell if that's sewage or if it's actual dead body." And then the next day, we found a lady hanging in the tree right off the road there at Twin Arrows. I was like, "Oh my God, it was a body."
Yeah.
Yeah. Twin Arrows used to be a really nice place. It's not anymore. Same with Buddha Hole. Don't recommend that. Would be kind of funny to like put it on the tourist thing, visit that shit. So. All right, let's see if I can find that again. Yeah, the one that I really did was a good one. I don't think they have. Not the same one. See how it looks. You can see the varices here. Hold on. That's not a healthy esophagus. Hot esophagus should be pink and soft. Should not look like that. Losing of blood and sores. And this guy's healthy compared to the one I used to have. There's the varices. You see those bulges coming out? Those protrusions. Gotta give it a flush. There it is. Yeah, the ones I used to have when they were actively bleeding, it's actually like a stream of blood coming out of them.
What caused all that?
portal tension from a liver failure, portal hypertension, hypertension to portal vein from liver failure. That is a really, this guy, there we go. That one's bleeding. That was actively bleeding. Band that puppy. Look at all that blood. Oh, there's another one actively bleeding. This dude's in bad shape.
Suppressive.
I can see face being split open. The inside.
Bad stuff. This guy's in big trouble. I didn't see him actually bend it though. Anybody want to go out for a drink after this?
Yeah.
Man, that is bad. Think about how uncomfortable that must be with those sores on the inside of your esophagus. Every time you eat, it's not sliding through those sores. Now he's gonna bend it. All right, here we go. Huh? Yeah. But he'd been hardcore drinking for decades. Hardcore, like drinking till you pass out 7 nights a week. That's hardcore. Neither do I. Yeah, so my head hits a pillow, I'm out. My sleep number bed tells me it took you less than 1 minute to go to sleep last night. Every night. Drives my wife crazy.
With this device, they have the ability to irrigate also. While
Yeah. To irrigate, they can band. It's called an endoscopy.
Oh,
They can irrigate, they can band with it. It's a pretty cool tool. Fiber optic camera, light. Ear, nose, and throat surgeon's a pretty spectacular specialty. These are truly highly skilled people. Yeah, so what it does is kind of like if you ever bended a skin tag.
Yeah.
It's the same thing. It just shuts the blood flow off to it, and it'll heal itself internally. If you can relieve the hypertension, then it'll just fall off the necrosed tissue. Yeah, you'll digest it. It's called Donner Party syndrome. It just digests the flesh. Some are big enough to block your whole esophagus, like that one. I don't see this guy banned anything yet.
Yeah, one.
Oh, did he?
Yeah.
Oh, there, he's doing this one right now. Think. Now he's doing it. There you go. Yeah, after it falls off.
What are the apples?
Huh?
What are
The what?
those,
What texture?
something?
The varices? What about it? I don't understand the question.
What are they?
So what it is it's a protrusion from the portal hypertension of the esophagus. It's putting pressure on the walls of the esophagus, it's blowing out the side of the wall of the esophagus with blood. Then they rupture and bleed. So he's going there and banding them to shut off so they don't bleed to death. There's no way this guy survived this. Wait a minute, so he came here from India? What about his socialized free medicine there? Oh, well. What's this? All right. Back to the presentation. So first stage is liver disease. You'll get fatigue, weight loss, you start to turn yellow. That's what jaundice is. Your skin and your sclera and your eyes turn yellow. And you start getting fluid retention inside your peritoneum. So kind of like a pleural effusion, but in your peritoneum, your abdomen gets huge. It looks like you're pregnant. They call that ascites. And the second stage is you'll start as the hypertension from the portal vein starts backing up against your esophagus. You start feeling discomfort in your throat. Then you develop varices, which will rupture, give a horrific smell similar to old stool. And you also have melanoma with the tube. Should be digesting all that blood. And it's rupturing inside your esophagus. It's a rough way to die. Any questions? So that's what ascites looks like. That's actually a skinny lady. Look at her arms. Yeah. So they can go just like they do with a pleural effusion. They can go tap that and drain it and make her skinny again. But within 2 to 3 days, it will refill completely with fluid again. From liver failure. Any questions? Gastroenteritis. The gastroenteritis is a catch-all term for all kinds of gastric problems, all kinds of diseases in the gut. In my career as a paramedic at EMT, majority of over 90% of the time when anyone's told me they've had the flu or flu-like symptoms, it's good gastroenteritis. Somewhere along the line, I have no idea where. The flu is a respiratory disease that causes mucus and fluid in your lungs. Has nothing to do with your GI tract. Somewhere along the line, someone told someone that the flu was gastroenteritis that causes you to have diarrhea and vomiting, which has nothing to do with the flu. In fact, COVID-19 first hit the media to create a worldwide panic. The first thing people did was they said it's very similar to the flu. They went out and they bought the entire nation out of toilet paper. Because people have no idea what gastroenteritis is versus the flu. Any questions about gastroenteritis? Very painful. It can dehydrate you. You lose control of your bowels and you vomit a lot until you get it out of your system. Usually some type of a bug, in your stomach, your gastrointestinal tract. Yes, gastroenteritis. There is no such thing as a stomach flu. The flu is a respiratory disease. So unless someone's developed lungs inside their stomach or the large intestine, there is no such thing as a stomach bug.
Right, let's just call it food poisoning.
There you go.
Easier this way.
Absolutely.
Vomiting, puking, let's just use simple terms from here on.
There's the signs and symptoms of the flu. Just kidding, gastroenteritis. Correct. Unless you work for the RETCC. I did.
So is it just like, it's not diarrhea just like once or twice, it's like, it's like all the time happening.
Every time you eat.
It's just water coming out sort of thing?
Yep.
Well, I lived in Asia for a while, it was pretty normal.
How many albums do they produce?
But
Asia.
one that I know of, they probably have.
At least two. It was an 80s rock. Yeah.
What type of shot is it where you, use too much fluid in your body?
Hypovolemic.
Is it possible to get that?
Yes. Especially children. Children with gastroenteritis get dehydrated very quickly. They end up in hypovolemic shock. And they're real little. They haven't fused their skull, their fontanelles yet. You'll actually see a dent in their head.
Yeah, yeah.
All right, diverticulitis is what happens when you're scuba diving and you rise up too quick. The gases inside your large intestine will blow out the wall of the intestine. Don't write that down. I'm just kidding. Has nothing to do with diving. Yeah, it has nothing to do with your intestines. The diverticulitis is when you're scared to go poop in public and you hold your poop for too long with a lack of fiber, and it blows the wall of your large intestine out and then gets infected. It's from waiting too long to go poop. Which is usually from lack of hydration, lack of fiber, and waiting too long to go poop. Now here's something we hope you'll really like. What is diverticulitis? There it is. See those things at the bottom, the left lower quadrant? Those are diverticulitis. See that ghostly shadow? That's poop. Oh, that's a good question. Pulse usually on the inside. Diverticulitis on the outside is blowing out. Pulse are gross on the inside that eventually can lead to cancer. Yeah. Isn't this attractive? I don't know. This isn't one of the better ones. I think it's kind of shitty.
Do they ban these things too?
No, they go out and they splice the colon and they have you poop into a colostomy bag for a while. Then when it all heals, then they come sew it together. Kind of like a film director, they just splice it out of the reel. So most common spot to have a diverticulitis is the left lower quadrant. It's the hardest bed for poop to make it around. Signs and symptoms of sepsis, nausea, vomiting, intense left lower quadrant pain. More water, more fiber, poop when you need to poop. Find the toilet.
Will there be blood in the stool for this?
No, usually it's sepsis. Not usually. instead of Crohn's. Maybe get more towards Crohn's though. People with Crohn's do get diverticulitis too. It's a double whammy. That's just your initials are GG. Connor's favorite. I'll put pictures on Facebook of it. There's a picture of a diverticuli with rupture. Any questions? All right, let's go for appendicitis now. So your appendix is so you can eat raw bacteria infested meat and not get sick. However, thanks to our amazingly overpriced FDA system, we really don't need our appendix anymore. Our food is pretty damn safe. Reasonably safe. Much safer than it was 100 years ago. Well, the problem now is when something goes wrong, our bodies are completely unprepared to handle it now. Our appendixes are like, what is this? Whereas then they used to be able to handle that stuff. But anyway, it's the most common cause of surgery in the United States. Appendicitis is an infection of the appendix. There is another thing called mesenteric adenitis, though, that mimics appendicitis. And about 50% of the same abdominal, when they do appendectomy surgeries, the appendix is fine because it's actually mesenteric adenitis, which is an inflammation of the mesentery, which are the tendons that hold all your guts in place inside your peritoneal sac. But if you don't go in and get your appendix out, it is appendicitis, and it ruptures, then you're going to get peritonitis. So if you get a ringing in your ear, it's tinnitus. It's ringing in both ears, it's peritonitis. No? It's not peritonitis?
No.
They're really.
Yeah.
Recycling jokes. That's because I don't drink enough caffeine anymore. Hey, guess what? I'm glad that you retained something. That means I'm in your head. Oh, that's so nice, Brady. Thank you. Signs and symptoms. So the telltale sign of peritonitis is what's called rebound tenderness, not peritonitis. Appendicitis, rebound tenderness. And that's when it doesn't hurt when you push in when you're popping to the abdomen. When you let go, then it hurts. That's a big sign. And if it's right lower quadruped with rebound tenderness and a fever, you should be thinking appendicitis. No, just say, oh, sorry about that.
No, I should say, how about the pause?
No, I mean, you just palpate like normal, and if on the rebound there's pain, like there's no pain when they go in, there's pain when you release. It's a positive sign. I always thought rebound tenderness was when you missed a basket and somebody else got it, you didn't have it. That had nothing to do with it. All right, AAAs. These are way more deadly than auto insurance. So AAA is a weakening of the abdominal aorta, and it's a silent killer because you don't feel it because there's no nerves down there. Can occur above or below the kidneys, and if it ruptures, generally you're not going to make it. 9 out of every 10 people with AAAs are smokers. Likely they can't prove it, but it's likely from the constant vasoconstriction of the nicotine. Any questions? Yeah. We only got 3 more minutes, so we're not gonna make it through this presentation. For the skiers.
This is what happened for us, for,
Abdominal's way more common. Thoracic, you know about it, you feel it. Because an abdominal ones, usually we don't know about it until it's almost ready to pop. Almost sometimes get a pulsating mass, or they'll complain of abdominal pain radiate like a sword going through their stomach, their back. Very similar to the thoracic one, but that's only like right before rupture. So like they say, it's a silent killer. People can have abdominal aneurysms for years and never know it.
did you see what I said?
I've never seen a pulsating mass. And generally, when people with AAAs and they tell me they're not going to make it, all right. We may move forward. They're often asymptomatic, meaning no symptoms. Then suddenly, one day, pain in the chest or abdomen right into the back. No pedal pulses, modeling skin, demarcation line. All very bad signs. Yeah. And it's very late sign. It's usually too late by the time you get to that. It's usually right about when you hear the wail of the banshee. You know, the Irish folklore. Banshee comes in Wales for some of your family dads.
That's similar to a hernia.
Banshee?
A hernia. That's similar.
No, nothing like. A hernia is generally a failure of the abdominal muscle wall. An organ protrudes out. AAA is a failure of the wall of the aorta in the abdomen and ruptures and you bleed to death. No, it usually doesn't hurt at all.
So what's the usual play?
No, usually what will happen is it'll finally be pain will finally start. And so they'll say a sharp pain radiating to their back.
That is too late.
Usually, yeah. You gotta get it in surgery stat. Yeah, smoking. Some do somatic. That's what it looks like. So that's the size of the aorta should be. That's the aortic aneurysm. Yeah.
Your surgeon will perform an abdominal aortic aneurysm repair to prevent the rupture of a bulging area of your aorta. The largest artery in the body is the aorta, which is attached to the heart and receives blood directly from the left ventricle or main pumping chamber. The aorta is divided into 4 parts: the ascending aorta, aortic arch, thoracic aorta, and the abdominal aorta. The abdominal aorta is the last and largest section of the aorta. It supplies blood to the lower regions of your body, including the organs in the abdomen and pelvis. The abdominal aorta ends around navel level, where it splits into the 2 iliac arteries that carry blood to the legs. The aorta has a thick wall, so it can withstand the high pressure of blood being pumped from the heart. Over time, the wall of the aorta may weaken, slowly bulging outward like a balloon. When this condition occurs in the abdominal region, it is called an abdominal aortic aneurysm. Your surgeon will perform an open abdominal aortic aneurysm repair when the diameter of your aorta exceeds 2 inches, or if you're having symptoms such as intense abdominal pain or an abnormally prominent abdominal pulsation. Before the open procedure, an IV line will be started to provide you with fluids, antibiotics, and anesthesia. A traditional open surgical repair is performed under general anesthesia, which means you will be asleep for the duration of the procedure. A breathing tube will be inserted through your mouth and into your windpipe to help you breathe during the operation. When you are asleep, a catheter will be inserted into your bladder. Your surgeon will have severe heart disease or a small incision in your groin over your femoral artery, then aneurysm. Using live X-ray pictures as a guide, your surgeon will pass an endovascular stent graft, a compressed fabric and metal tube, through the catheter to the aneurysm. Then he or she will open the graft, which will be held in place.
All right, why don't you guys go to break? Be back after 5 minutes after 8, ready to go into teams. And we have new teams.
Mike. It's a good thing because we only have like 4 more people here today. They're dropping like flies.
Super smart. You don't have a problem. Freaking himself out. It was amazing to watch. Wow. Was it Matt before? Texted me from the very. He's got a shirt hyper aware. Not good. Oh yeah, Mike. So my class, in kindergarten graduation, we had, all the way through it, we have probably 14 kids that stayed together all the way through it. Class of about 20, but only probably 14 were there from kindergarten all the way to the graduation. Of those 14, 3 had the last name in the church. Dead serious.
My sister.
Max.
6 years. Oh.
Pretty sure Max is awesome. In terms of people, I have no idea.
Just trying to make it all. Huh? His life. No, because like let's talk about people have the same first names. Yeah, we have 2 Chris's. We have 3 Bradens, 2 Katies. Oh, I don't know. I wasn't on it. I wasn't with me. I ran 2 grades on my own. Yeah.
Which one?
I had the real Jeff.
Oh, I just
Freaking blew her head open. But we don't know what happened. Kind of body on turkey. With blood flowing outside of her head. What's her ex? I think she hit the curb and they drove her away for CPR at the street. Law enforcement did CPR on the street. And yeah, 5 rounds of CPR got her back. And they put her right up for people who fixed it. Well, see, that's what I was looking at. And then
I'm sorry.
Nordic Chilean,
My brain.
so I got her stripped down to here, but I didn't get the bonus in the leg strip. We were literally a minute from the hospital. So once we got Ross, I said, load me up, we're leaving. So we just put a call on us, put our blood pressure distractor and just ran. And, and she, yeah, it was Dave. Was it gonna be with Dave?
I didn't even see the way.
But anyway, we got to the hospital, she went full arrest to go to the hospital. Went around to CPR, got a pulse back in, and she sustained us back. And blood pressure, but it wasn't looking, so I said, the whole, she had an open skull fracture. It was huge. And then Chile said, in the same strip, they found abrasions on her pelvis and down her leg, and then she started developing.
Everything now.
Well, YPD was pulling the ring doorbells, trying to figure out what happened. But someone said she got hit by a car and they disappeared. So the city was like, well, she got hit by a car. Where's the witness? It's like, get your gentry over there. We don't know where she went. So they say she got hit by a car and they disappeared. By radio. Then I got the next call. I was still in the hospital. They were bringing it. So, Brian,
You two
yeah,
combs, that's Sierra.
yeah, she done. Well, she said she wasn't gonna drop, but she's not here again tonight. It's 2 nights in a row.
Yeah.
So,
You wish you could just do that, like scan it all. USB.
she made changes.
Anyways, just bringing that up.
Cool. Well, you guys only have 5 instead of 6 then. Chris. Oh, yeah. Yield trip's gone and so is, and Baker's gone. Yeah, guess what? Real life teams change. Yep. But sometimes groups change.